Assalamu alaikum, dear viewers. So once again, welcome to my new class. Dear students, today I will teach you fluoroquinolones or quinolones antibiotics. Fluoroquinolones, these are broad spectrum antibiotic which are mostly effective against gram-negative bacteria. That is also bactericidal in nature. The good examples of fluoroquinolone, that is ciprofloxacin, levofloxacin and ofloxacin. Mode of action or mechanism of action of these antibiotics, so they can directly act on the DNA and they can interfere with the bacterial growth and replications. As we are using different type of antibiotics, so in order to inhibit the growth of microorganisms or to kill them. So actually these fluoroquinolones, they are responsible to stop or inhibit the DNA synthesis and interference with bacterial growths, so it can stop the replication, so the organisms are become unable to survive. They can also directly act on that particular pathogens, and actually they can stop or inhibit the DNA replications. That's why there is a competition between microorganism and antibiotics. So now let's come toward the pharmacokinetic profile, the indications of fluoroquinolone. Fluoroquinolone, so they are widely used in the treatment of typhoid, which is caused by Salmonella typhosa, as well as the typhoid. They are also used in the treatment of UTI, urinary tract infections, gonorrhea, syphilis and gastroenteritis. So as we know that, so ciprofloxacin, this is the drug of choice for gastroenteritis, and these fluoroquinolone, they are also used collaboratively in the treatment of bone and soft tissue infections as well as conjunctivitis, which I have mentioned already here. These fluoroquinolone, these are not safe in pregnancy and especially in children, because it can destroy the growing cartilage. These fluoroquinolones, if it can be used during pregnancy and especially in the children's, it can destroy the growing cartilage, especially the epiphyses, the bones of the long growth, so it becomes stop. The side effects which are reported by the different literatures, so you can see here on the slide. So after use of fluoroquinolone, there may be chance of GT, gastrointestinal distress, unpleasant taste, dizziness, as well as and confusion, photosensitivity and skin rashes can be developed. Now come toward the general classification of fluoroquinolone. So they are divided into 4 different generations. So as we have already discussed in our previous lectures, so the first generations include cyanoxacins, nalidixics and oxalic acid. The second generation antibiotic, that is ciprofloxacin, enoxacins and fluoroxacins and levofloxacins, norfloxacin, ofloxacin and rofloxacin. It is not necessary that each and every drug will be available in the market by this name. So there are some drugs which are still they are under investigation and they are not approved by the Food and Drug Administration, FDA. So after that, these drugs will be launched in the market and then the patients will become able to utilize it. Okay, another one is third generation antibiotics. So third generation antibiotic, that is gatiploxacins and rifafloxacins and fezofloxacins, parfloxacin and tosofloxacins. They are also under investigation, but there are some drugs which are still they are available in the market. That is, for example, gatiploxacins. The 4 generations is which include clinafloxacins, chemifloxacin, moxifloxacin, and trofloxacins. So what does it mean? Which we have already talked about the different generation, the different antibiotics, that how these drugs can be used, and the variety of infections. Like the gram-negative activity of the 3rd generation is greater than second generation, and then the activity, the gram-negative activity of 2nd generation is greater than 1st generation, while the 1st generation antibiotic, they are active against gram-positive. Okay, now let's come toward the nursing care. So now there are some special responsibility of the nurse as well as those who are working in healthcare professions. So let's suppose the nurse is responsible when he or she is administers IV intravenous ciprofloxacin, Vedades, and ofloxacin. So it should be infused slowly into a large vein over 60 minutes to minimize the discomfort in venous irritations. The second core responsibility of the nurse, he or she is also responsible to administer the drug with precautionary measures, especially in a patient with CNS disorder. Those patients who have central nervous system brain disorder, so these drugs can be administered with full precautions. The nurse is also responsible to avoid taking with 22 hours of antacid administrations because in order to reduce the absorption with the antacids. Another responsibility of the nurse, he or she should avoid exposure to the suns because it reduces potency, the power. The nurse is also responsible to administer drug with full glass of water, and he or she should monitor strictly for bleeding. He or she should check the bleeding if administered with the anticoagulant, so as well it can increase the plasma concentration of warfarin. So all these parameters should be checked, which is the core responsibility of the nurse, because he or she is directly involved in patient counselings. But pharmacist, who is the qualified person who is expert in drugs, so the pharmacist who is responsible, especially in dispensing, he should take care during dosings, how to administer a drug to the patient, so how much dose that is required for the patient. So the pharmacist is specially responsible for the dose adjustment, especially he or she should be careful whenever he or she is going to administer a drug to the patients. So now come toward another antibiotic that is also called macrolide. So macrolide is dose dependent bacteriostatics and bactericidal effects as well as broad spectrum activity, mostly for gram positive, only few gram negative they are also covered. So it means that macrolide, so this is the boundary line between bacteriostatic and bactericidal agents. So it is this is actually a dose dependent bacteriostatics, depend upon on the dose whenever you are going to increase or decrease the concentration of the drug. Now come toward the mechanism or mode of action, that how the drug can show their pharmacological activity, and then this drug can reach to its target site. So the major mode of action or mechanism of action of these drugs. So it can inhibit the bacterial growth by interfering with the protein synthesis in bacterial cells. Actually, these macrolides, which include clarithromycin, azithromycin, telithromycins, and many and more drugs. Macrolides, they can directly stop or inhibit the bacterial growth by interfering with the protein synthesis in bacterial cells. As we know that there are special proteins which are produced inside the bacterial cells. So first of all, you will have to target that bacterial cells, that area where the proteins are synthesized. Ribosomes, which is responsible for protein synthesis. So these drugs can directly act on that particular area which is responsible for the formation of protein. So this drug can stop or inhibit the bacterial growth by binding with 30S and 50S ribosomal subunits. because these ribosomes are responsible for the protein synthesis. The classical examples are erythromycin. So macrolide include erythromycin, azithromycin, clarithromycin, and sphleromycin, roxithromycin, etc. These are the examples. The clinical uses of macrolides, these are the clinical uses. So they are used in the treatment of urinary respiratory tract infections, skin infections, pertussis, syphilis, diphtheria, intestinal infection, alternate use in penicillin G allergies. So there are some patients which are allergic to the penicillin, so you can use the alternate brand. Okay, now come toward the side effects which are reported by the macrolides. So macrolides, these are the side effects which you can see here. Macrolides, it may cause mild and severe hypersensitivity reaction like epigastric pain, diarrhea, reversible hearing impairment, hepatotoxicity, and jaundice. The routes of drug administration for the macrolides, that is per oral route, as well as it can be administered in the form of parenteral routes, so that is IM, intramuscular and intravenous. The special nursing care of macrolides, so nurse is also responsible whenever he or she is going to administer erythromycin. So erythromycin, it also belongs to macrolide, so it must be used cautiously in a patient with history of hepatic impairment. Let's suppose if a patient who is suffering from liver's cirrhosis. So especially in that case, you will have to supervise, you will have to administer the drug with precautions. Another one is IV erythromycin, so intravenous erythromycin. So the nurse is responsible for the, especially for the administration of these drugs like IV. So if he or she is going to administer intravenous erythromycin, so it must be diluted sufficiently, its concentration will be reduced. So after that it will be administered slowly and gradually. The nurse is also responsible to monitor the hepatic function periodically, or he or she is also responsible to administer with full glass of water with meal. So depend upon the drugs, depend upon the dosing frequency. So oral suspension should be refrigerated and shaken well before use, as we are using different type of suspension. So you can keep it especially in refrigerated and shake well before use. These are some miscellaneous antibiotic which you can see here, miscellaneous antibiotics. So these are antibiotics which are the only agents available in their classes. Miscellaneous antibiotic, that is vancomycin HCl. So vancomycin, this is also the drugs which come under the category of miscellaneous group. So actually it can directly interferes with the cell membrane synthesis and exhibit or increase a bactericidal and bacteriostatic effects and use mostly for gram-positive infections. Vancomycins is the name of antibiotics which is clinically they are recommended for the hospital-acquired resistance infection, mostly useful for the methicillin resistant Streptococcus, Staphylococcus aureus, that is called MRSA, and VRSA, vancomycin resistant Streptococcus aureus. So these are the clinical indications. So now come toward the side effects. So these are the side effects which are reported after administration of vancomycin. So these are the side effects in the form of ototoxicity, nephrotoxicity, thrombophlebitis, Redman syndromes, and hypotension from rapid infusion. So it releases histamine with rapid infusion and causing vasodilatations. So I mean that with the use of vancomycin, so it may also produce different side effects that is related to ototoxicity, toxicity of the air, nephrotoxicity. So it may become the cause of it may damage your kidneys, thrombophlebitis and Redman syndrome, etc. So with rapid infusions. The nurse is responsible for different type of care. So nursing care, nurse is also responsible to monitors. He or she will check the intake outputs in many and more conditions. He or she should obtain and monitor the renal and auditory function test of the patient, so we can also administer the intravenous, the drug intravenously slowly, IV. That is you can say 1 vial diluted in 100 cc's. It means that you should dilute 1 vial diluted in 100 ccml, that is normal saline, only and given over 1 hour. So look for the serum creatinine as well as the blood urea and nitrogen, so all these parameters should be checked, and have its serum level checked periodically. This is very important. So this is the basic nursing care, inshallah. Okay, now let's see the chloramphenicol. So this is another group of antibiotic which is broad spectrum and bacteriostatic, should be reserved as a last resort due to fatal adverse effects. The mechanism of action or mode of action of chloramphenicol, so it can decrease the protein synthesis, thus decrease the bacterial replication. So whenever you are going to stop the protein synthesis, so then the bacterial production of the bacterial replication will be stopped. Indications, chloramphenicol, they are also used in the treatment of enteric fever and serious infections such as H. influenza, meningitis, and aerobic brain abscess. So these are the major clinical conditions in which you can treat a patient with the help of chloramphenikols. These are the side effects which are reported by the different type of literatures. Especially it may cause, after using of chloramphenicol, so it may cause hematological disorder like bone marrow suppressions. It can inhibit the red blood cell maturation, cyanosis, and hypersensitivity. The contraindication, the chloramphenicol, it cannot be means the prophylactic use. It cannot be used while in case of hypersensitivity and pregnancy and lactation. These are the conditions you cannot use these drugs. So chloramphenicol is contraindicated, especially in pregnancy, lactation, hypersensitivity, and many more conditions. Thank you so much. Okay, now come toward the nursing care. Use cautiously in a patient, children, patient with history or family history of bone marrow suppressions. So take oral drug with full glass of water or empty stomach. So monitor chloramphenicol blood levels. Check the complete blood count before and during and after therapy, and never use for minor infection or when separate drugs are available. So this is the basic nursing care, which is very, very important. Inshallah, in my next lectures, we will discuss about the AMINOGLYCOSIDES, which is also another group of antibiotics. So if you have any question regarding this lecture, so I am available for your services. Thank you so much, my dear students and reviewers, for watching my channel. Thank you.